say this is irrelevant clause they have come out. If I'm registered, if I have an ultrasound machine, and if I am registered, my machine is registered, I am registered. Previously, mobile vans were registered, and my mobile van can do cases anywhere. Another absurd thing is, why echocardiographer should be treated as ultrasonologist? Echocardiographer has nothing to do with abdomen. He has nothing to do with pregnancy. If an echocardiographer is doing echo machine, why should he be registered under PNDT Act? Unless he is doing a pregnancy and fetal studies. And for fetal studies, there are fetal medicine specialists. Why should it happen? This should be exempted. The medical fraternity need to come out with views, and we need to fight about that. Another thing which was new in 2009, to prevent mother-to-child transmission, and all HIV-positive pregnant women should start using the drug at 14 weeks of pregnancy instead of 28 weeks. This is a change in guidelines. We must note that. Cervical screening guidelines also changed in 2009. In its revised guidelines, the American College of Gynecology now recommends delaying the start of cervical cancer screening until age 21. And then screening most patients every other year instead of annually. That means start pap smear at 21. Don't do it every year. Women between 21 and 29 years should undergo screening every 2 years. And women aged 30 or older who have had 3 consecutive normal results can do it every 3 years. This is for normal population, but not the high-risk population. Breast cancer screening also changed in 2009. Earlier, it was 40 years, that at the age of 40, you should start doing mammogram, but now this is not required. Unless a patient is at a high risk, start at the age 50. So these are a couple of changes which have happened. There has been a lot of changes in the city of Delhi. New hospitals came in 2009. Medanta, the Dr. Naresh Trihan's dream became true, started in 2009. Mulchand became a med city. Batra Hospital showing a lot of changes. B.L. Kapoor Hospital started functioning. Another drug alert came in 2009. Physicians should carefully prescribe anticholinergic drugs. We are talking about OTC, that means Cosavel, Vicorel, and these drugs to elderly people, especially those with genetic risk of dementia, not able to avoid side effects of, this is not only to avoid side effects of urinary retention, constipation and dryness, but due to associated risk of short-term cognitive effects and dementia in long term. That means we have a habit. In elderly people, he comes with cold. This is the season of cough and cold, and we start prescribing anticholinergic drugs. The anticholinergic drugs should not be prescribed in elderly people because it can precipitate dementia attacks. This is a new warning which came in July 2009. Open for discussion. These were the new things which I thought was something new in the year 2009. We have around 10 to 15 minutes for discussion. Anything else somebody else observed? Apaja. Your comments, and if you want to add something in the year 2009.
Regarding the new HIV guidelines, because I am looking after exclusively HIV medicine. So, sir, actually, stage 3, when we start treatment less than 350, CD4 count less than 350, not only pulmonary tuberculosis is important, because most of the patients we see here in LNJP and other centers in ART, that people, they don't actually exclude the other form of tuberculosis or other conditions which falls into stage 3. So we have to see whether these patients, they are fulfilling the criteria of stage 3, and if they are having the stage 3, then we can start. Second thing is, ART should be start now. Stage 4 is less than 250. So earlier it was 200, now it is less than 250. And most of the patient who is having a stage 4 disease, they are having other OIs also. So once anybody start the treatment, we should observe the actually iris or other complication, because there is reversed immune response. And when we start the ART, maybe within few days or few weeks, patient may develop severe infection, or there is a exaggerated immune response or exaggerated existing infection is there. Any question regarding HIV if you have, or H1N1?
If you can see this slide, this is the live webcast. I've just connected to the site docconnect.com, and this is how you can see, this is how the slide appears. There's a video, there will be slides, and everything will appear there. So people can watch this, you can go back, and whosoever has come late, they can go back in the evening, go to docconnect.org or eMedinewS.org, and you should be able to see whatever you have missed today. You should be able to rewind it and watch it. Okay, please. HPV virus vaccine. Anybody who is aware of that? Any guidelines which have come? This is a new vaccine which has come in India also. And this vaccine, I don't have the slide with me at the moment for the guidelines, but the guidelines are available. So for prevention of cervical cancer, this vaccine should be used. We will have a gynecology section in the afternoon. They're going to cover it. We have a couple of gynecology sessions, and they're going to cover that particular session. Okay, yes, please. Please come here in the front, take the mic, speak out. I want one volunteer here, जो mic take लोगों को, एक यहाँ पर है. One mic, the audience mic. Audience mic, there is a.
Hello. Sir, your views on short-term medical course, that is DM.
My views on short-term
medical
I
course.
think my views will not matter. The fraternity as a whole will need to decide whether we want it or not. There are mixed views coming at the moment. There are plus points and there are minus points. The minus points I can narrate. One of the minus points will be that 4 or 5 years from now, they will go to Supreme Court and say, make us at par with MBBS. 5 years from now, they will go and ask the Supreme Court, allow us MSMD. And if you can't allow us MSMD, create MSMD into rural medicine and rural surgery. These problems will come.